All right, so we are recording now. Again, we are 6 o'clock Eastern time here on this Thursday, July 24th. We'll be here from 40 to 50 minutes, all depending on how things go. And we are going to be going over NCE stuff. So again, I will leave the door open for questions. I will monitor the chat box. So if anyone has a question, you can either can, of course, ask it to me in your microphone. You could message me in the chat box, and I will keep an eye on that. Also, I will post in the chat box, in addition to these Facebook Live things we do, or I do, one-on-one individual sessions. So we got some discount codes that I'm going to post in that chat box as well. I'll, there you go. All right, and also discounts to other boot camps. But anyway, again, I'm going to open it up right now for any questions. Fire away. And if I don't get anything, I'm just going to keep just going over some stuff that I'm hearing of some of the key points for this Facebook Live. And the breakdown has been pretty consistent for the last 5 years. And basically, it always, starts with the helping relations. I always tell people when they ask, where should we start? You know, and I always say helping relations because, again, that's about a third of the exam. Again, give or take which form you have. Obviously, if it might be, you might get one or two more, one or two less, but it seems it's about a third of the exam is helping relations. And so I don't think that it's hard to argue, but the biggest guy in helping relations might be this guy. Carl Rogers and person-centered. And again, we're talking about humanistic approach to therapy, not a come in for a prescription diagnosis. This is a person-centered, you and I. And I always tell people if you ever forget, look at the name first, because it doesn't always, but sometimes it can at least move you to what the idea is. And again, person-centered, the client is the center of the counseling process. And so that is where this starts. And again, the famous terms, unconditional positive regard, empathy. I get what you feel. I'm not going to cry with you because that's sympathy. We don't do that with clients not on the exam, not on the real life. Congruence. I'm actually being real with who I am and what I'm doing. They're not putting on a facade. And of course, genuine. We're those kind of words is you and I are going to figure this out together. Carl Rogers, you see right here, kind of looks like a grandfather that is going to basically, want to talk things through. Psychoanalytic, psychodynamic, still a big guy. And again, I say big guys meaning the heavy hitters on this exam. I mean, there's little people, and you might get one or two of them, but I think it's more likely that you're going to, to focus on the big people. And Freud, psychoanalytic, psychodynamic, that's a big person. And with Freud, we're talking about starting with the id, ego, super ego, kind of like that good cop and bad cop, angel, devil, with the id and the super ego, and the ego is the person who's in charge. So again, that is Freud. And of course, with Freud, the oral, anal, phallic, latency in general, the psychosexual stages. And of course, in that power phallic stage, it's the Oedipus and the Electra complex, those two famous words. Oedipus, the mother-son relationship, Electra, the father-daughter. So again, things you want to be mindful of. And Freud is about the unconscious, making the unconscious conscious, and the defense mechanisms. Those are big, heavy hitters with Freud. These are some of the more famous defense mechanisms that we got to know. And some of them are in the name itself, such as, hang on a second here. I always like to start with the ones that are kind of the face value one, and that's denial, the flat out refusal. I may be lying. A lot of times it's in addiction, substance abuse, but I'm consciously lying, or I'm at least refuting, denying, denial, it's called. Um, Regression. When you think about if you're regressing in life, you're taking steps backwards. So with Freud and defense mechanisms, you're acting backwards in time. So an 80-year-old will take off his shirt and run on the beach like a 20-year-old. A 16-year-old would wear diapers like a 6-month-old. So wherever you are in life, you're going backwards. Projection. We're projecting our feelings and thoughts onto somebody else, putting me onto you to feel more acceptable in this. And then, of course, we have displacement, satisfying the impulse with a substitute object, generally in an inappropriate or by societal standards, an unacceptable way. So you had a bad day at work, you go home and you just take your cat, you toss it across the fridge or the kitchen towards the fridge. That is a defense mechanism. Also, uh, sublimation, that is doing it in a socially acceptable way, unlike displacement. So, in other words, you're going to go instead of that, throwing the cat against the wall, go to the gym. You're doing it in a more appropriate way. And then, of course, repression and suppression, when those memories are pushed back automatically or consciously. If you're actually basically in the denial sense, I don't want to talk about it, that is suppression. If it's just kind of pushing it away from you with a subconscious, unconscious, mechanism, in this case, it is repression. And then, of course, reaction formation, it's displaying the opposite of how you feel. If you love someone, you're going to be rude to them. If you hate someone, you're going to act sweet towards them. All right. I think CBT is I said Rogers is the most popular or the biggest guy. I think of CBT as the most broad form on this whole uh, spectacle, because why is anyone in therapy to begin with? Because of how they're thinking. So we got to fix that. And of course, CBT, as you see here, this is Hellwig, of course. So if you're curious, aside from the fact that we're going to, by the way, I'll just back up a second I know people have just checked in, which we are recording, and all this material, which is Hellwig, you're going to get from Hellwig. You'll get the material sent over to you if you haven't already, and also the access to this recording. And as you see here, CBT, we got a whole army of people. Again, this is such a broad scope because it's all about therapy is how we're thinking. So I always tell people, if on an exam you got a question, you have no idea what the answer is. You have no idea. And CBT is an option, not a bad option to go with, because again, why is anyone in therapy to begin with? Now, if the person is mentally ill, or if they struggle with cognitive recognition, maybe not the best option to go with because they don't understand what's going on as much. But if they do, you probably want to go CBT. Um, and of course, as you see here, a whole army of people. And we're here. Where is this? And then, of course, one of those individuals who are on this CBT is Albert Ellis, and Albert Ellis is. Let's go back. Let's go here. He is REBT, and I always like to go from CBT to REBT because, as you see here, Ellis, basically what we got with him is he was in CBT, if you recall. Now he does his own thing, or did his own thing, and with that, him doing his own thing, very similar, only more specific. It's called in REBT crooked thinking, and it uses a technique called the ABCDE approach. So again, if you get either of those, that is REBT. Even though it kind of sounds like it could be CBT, it's not. It's REBT. Alice is REBT. So again, more specific, because again, irrational thinking, then those negative, things. But again, that is Mr. Albert Ellis. Gestalt. So again, we went from talking about psychoanalytic, psychodynamic, the unconscious, conscious. We talked about the humanistic approach with Rogers. And of course, in REBT and CBT, how we're thinking, this is an experimental talking about Gestalt here, an experimental approach to therapy. Gestalt, dealing with the here and now, and to deal with the here and now, we got to fix that unfinished business, the baggage. So again, the most famous technique, the empty chair. You ask, you almost like ask the client to stand up and pretend someone who he's having issues with is in that empty chair and talk to that person. If they're, obviously this can help if the person's deceased, because we have to do it experimental, because we can't bring the person back to life, and it's getting things off your chest. It's getting the, spitting out all this, negative emotion to move on. Fritz Perls. All right. Existential. That's the other one. Viktor Frankl, you see that picture right there? He was a prisoner in a concentration camp, and he wrote a book called A Man's Search for Meaning. And this idea is, even when you're on the lowest form of, near death, the worst case scenario, you can still see light at the end of the tunnel, be independent and responsible, set long-term goals. Remember that, because I'm going to go to something called short-term goals in a second, but this is long-term goals, and you could live a meaningful and fulfilled life. And Maslow's hierarchy of needs is part of existential. So again, this is almost like Tony Robbins therapy, a millionaire trying to become a billionaire, a poor person trying to be a successful person. Wherever you are, you're trying to go one step or 20 steps better. Existential. And again, for those of you just checking in, we're on Facebook Live, and if anyone has any questions, fire away in either the chat box or in your microphone, and I'll answer them. Because again, I want to just kind of respond to anything that people have questions, concerns, or unknowns about. Right now, I'm just going through helping relations, but I will switch gears with any suggestions or things that people want to talk about. But again, this is helping relations is the big heavy hitter on this exam. And I mentioned earlier the long-term goals of existential, because in Adlerian, we're talking short-term goals. Alfred Adler, again, look at the name, individual psychology, the uniqueness of the individual, their history, their short-term goals, their, everything that makes them unique, from spiritual, health, physical, psychological, anything that you could think of. And the key term, just like what we think of when I think of Gestalt, or when I think of empty chair, I think of Gestalt. When I think of unconditional positive regard, I think of Rogers. Birth order should come front, should be raising red bells and sirens when you think of Adlerian. It's about where you are in your sibling pecking order, because that, according to Adler, has a determination on your level of independence, maturity, and all that other good stuff. And of course, the paradoxical intention, where you're prescribing the opposite. So that is something in which, if the client says, I got social anxiety, I bite my fingernails whenever I do a presentation, I would ask the client, when's your next presentation? 2:00 Friday. Okay, 1:55, look up at the clock, and you bite the heck out of those nails. And then that's a paradoxical. And I mentioned earlier that we have a special guest that is coming in, and Dr. Pam?
Can you hear me?
I sure can.
And see me?
I sure can, yep.
Hello, guys. How are you?
Hello, how are you?
Good, thank you.
There are
Hi.
like 22
Great.
people in this room. Okay, now, so Jeremy, I know it's your podcast and you decide this, but I'd like to see the people. You guys turn your camera on just for a minute. You get to see me. Let me see you. So, if you're in any of my sessions, your camera has to be on. Beautiful people. Come on. I know. There we go. Look. So if you're ever in one of my sessions, your camera has to be on. And the reason is just because what's attending skills? What are those? We see that in groups sometimes. Attending skills. An A, don't we know those?
Yes, you can see like verbal and nonverbal. It's like,
Ding, 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 ding,
Right.
ding, ding. So if Jeremy asks a question and you don't understand and you might not say anything, he can see that you don't know by the look on your face. So he doesn't care if you got your bonnet on. I swear, all he asks that you're covered from here up. That's the minimum requirement. But definitely, it makes it easier for him to see if you don't understand when the questions are when he can see your face. That's all. That's really show up, get the best out of him. He's amazing. Can I just sit and listen and let you keep talking?
Yeah, sure. If I wasn't sure if you wanted to jump in. Feel free to jump in and take over anytime. But
no, this is your
okay.
show. By the way, you guys, everybody on our staff was in your seat. And Jeremy is amazing, absolutely amazing. You are very lucky that you have him. He is all that and a bag of chips.
Thank you.
I think that's an old saying.
Yes.
Like my daughter would say now, something about 8, like no crumbs left. Is that the right terminology?
yes, it is.
Okay. Because I have to go to the Urban Dictionary and look it up because I don't always know the best terminology these days. But do you guys want to ask me anything? Jeremy can answer anything I can answer. Go ahead, Jeremy.
All right. So like I said, we're going through helping relations right now, and as I mentioned earlier, and it still applies. If anyone has a question or anything specific that they want me to go after, let me know. And whether the chat box, whether the microphone, but I'm just going to keep going and until somebody jumps in. And we just went through Adlerian, talked about the paradoxical intention, and now we're going to move to TA.
Can I ask a question?
Yeah, please go ahead. Yeah.
So Adler did do paradoxical intention, but he's not the one who's most famous for it. Which family theorist is most famous for the paradox or prescribing the symptom? He's the one that talks about how we communicate to each other, first and second order changes, not minutia, not structural. Bowen is Gina Graham. Bowen is, girl, you be doing the same stuff your mom and them did.
Structural family theory?
It's the other one. It's not
strategic.
Jay Haley or Chloe Mendez. So that's usually when I'm looking at a test question, but he's absolutely right. Adler did it, but we saw it later in our families, and strategic family therapy talks about how we communicate with each other. So we'll see that there as well.
Excellent. TA, transactional analysis, Eric Burney. So this is, of course, 3 ego states: parents, adults, and childs. And I tell people the complementary and the cross transaction. This is life scripts. And according to Eric Burney, we do better when we're communicating with people in our own wheelhouse. Parents to parents, adults to adults, child to child. If we're going in our, this way, it's a complementary transaction. When we go, I don't know if you could see my mouse here. I think it's gonna be kind of small. Parents to child doesn't work out as well. Leads to barriers. That's a cross transaction. And Eric Burney wrote a book called The Games People Play. Again, trivial piece of knowledge, but he's a big guy, so it's not out of question that they couldn't ask you what he wrote. Just like Viktor Frankl wrote that book we were talking about earlier, Man's Search for Meaning. So, all right.
Jeremy, can I share my
yeah,
screen
please fire away.
for
Yes.
a minute?
You want to share a screen?
If you don't mind.
Yeah, no problem. I'm going to unshare mine. And do I have to give you permission to share yours, or can you just?
I think you're the host, so you got to give me permission.
Okay, so let's see. Let me go to participants, find you, and
By my name, there's 3 dots, and you can make me co-host if you don't mind.
yeah, I think I just have to make you a host. I don't think they don't give me co-host options, so I'm going to make you the host now, and then you'll have to, I guess.
I'll have to give it back to you then.
Yeah,
Can
perfect.
I
All
make
right,
you co-host?
it's all yours.
Wow, I can't make you co-host. I don't know why. Okay, so this is the one that I prefer, and just because it's simple to me, all those lines make me crazy. You guys also that I learn best by listening. Can you share my TA screen? Do you see? So this is the one that I prefer to use. And again, you guys know that I like to use it in the real world. So do you see that first one, complimentary? All of us need a good girlfriend. When I'm coming from my childhood state and I'm 60, wearing this little outfit, thinking I've got some booty shorts on and some boots, and I'm out there, with my fan, my girlfriend needs to say, Pam, you are old. Go sit your butt down. We need somebody in our life, right? To really, when we're coming from our childhood state, to keep us in check. That's okay occasionally. We don't want to live that way, but it's definitely okay. Come on, girl, you got some friends that, girl, you need to go home and shave that mustache, right? Come on. We need that in our lives. We all do. So Eric, he is absolutely right. But I really like you to use it in the real world. So even a married couple, imagine, your spouse wants to go buy a boat. You guys are barely paying the mortgage. Somebody needs to come from their parent stage and say, baby, I love you, but we can't do that. Y'all got some good girlfriends. Baby, you shouldn't be wearing that. Come on. I'm sorry, Jeremy, that's a girl thing. I don't know that guys do that, but it's a girl thing, honey, girl. You need to, don't be wearing that no more. Okay. So that's what it looks like in my life. So it's not really that I am a child. I'm just using my child ego state. And I also learned my script in childhood. Stomp my feet, get what I want. None of you, other people, right? But yes, definitely. And if you haven't, I have a video where I talk about dog court, and I was in dog court for hours, and my lawyer told me to go sit in the corner and shut up and sit down, because I was coming from my child state, and I probably would have been under the jail if I'd gotten on that stand. So definitely that's a theory that you need to know. I don't see a lot of questions on that. Jeremy, how about you? Have your students told you to get a lot of questions on TA?
Not a lot, but but just to understand the ego states. And yeah, you're right. I would say not compared to Roger CBT. You're
In
right.
reality, a lot of reality there.
Yes, yeah.
But this is definitely on there, so don't not study this. And I'm sure Jeremy has told you that these are the points, guys. These are the points where they're coming from. There's almost 100 points of knowing your theorist. And I need to know TA, whether it's an individual, whether it's in a couple, whether it's in a group, whether it's in a family. And on Facebook, we had 5,000, oh my gosh, group questions. They were really about theories. You just got to know these up, down, left, right. Okay, I'm gonna stop sharing.
All right, and I'm gonna
Do I need
share.
to make you host again?
Actually, I think I can share it. Yep, I'm good. All right, so we're back. Actually, let me do this. I'm gonna try to do this in a way where we can see it better. Mark. All right, so now we're moving ahead towards DBT, dialectical behavioral therapy, and by Marsha Linehan. And this is one of the ones that, people ask, what would you use this for? It was created for borderlines. So I always, from an exam standpoint, if there's a question where they're asking about a borderline, I look for DBT. If they're asking about DBT, I look for borderline. Now, it can be used for other things like mood disorders, eating disorders, but it was created for borderlines. And 4 techniques, which basically are a perfect match for a borderline client based on what they show symptoms of. And that's mindfulness, being present in the moment, experiencing things non-judgmentally, emotional regulation, because their emotions are all over the place, distress tolerance, and interpersonal effectiveness, dealing with people. And again, this is maladaptive thinking. So this is not a quick fix. Just like a borderline, just like an eating disorder, there's complexity. So borderline, Marsha Linehan.
Can I stay with you again for a moment?
Fire away. Yeah, fire away.
So there is an early, there's a neo-Freudian that says that borderlines come because you didn't have a good attachment. Who's that?
Margaret
May
Mailer
Margaret
or something.
Mailer. Yes, very good. She's one of the theorists. Is that she says if you don't have that one attachment, of course, that's not the only reason for borderlines, but that's what she said. She said if you don't have that attachment in those first 3 years with that one caregiver, remember she's a neo-Freudian, which means
Unconscious.
ooh, how's she different than Freud then?
She leaves out the sexual.
Dang, 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 no
mm.
sex, baby. That's
Mhm.
right. Only Freud is sex. So that whole id and super ego fighting back and forth. Neo-Freudians don't believe that. And in the textbook, and I don't know that I don't teach all those lists of Neo-Freudians. I teach the big ones, and Margaret Mailer is one of them. So she says that, hey, because you got passed around, you grew up in an orphanage, something happened that unconsciously you never knew that you had a secure base. So I think that's where she believed that borderlines come from. She also believed a couple of other personality disorders. Any others that we can think about?
You always talk about reactive attachment.
Mm-hmm. So little kids, right? Little kids who don't bond. We see that kids who are adopted, right? And they try to kill everybody in the house, and mama has a baby or a biological child, and they try to burn down the house. I had a question on that one. I was gonna look for it. I can't find it when I need it. It works that way. Go ahead, Jeremy. I'm sorry to interrupt.
Speaking of the neo-Freudians, I've not gotten to this yet, but maybe it's a good jump, is there's a few neo-Freudians, Karen Horney, Eric Fromm, and Harry Stack Sullivan. Again, they moved away from Freud's emphasis on the id. And these are 3 people. I don't know if I call them big guys or medium guys, but they could pop up, and they are 3 people with 3 different philosophies. Karen Horney is the idea that security is the major motivation behind each person's motivation. So if you're in a bad area of town and your security system is broken, you got a problem. You're out of whack if you don't feel like you're secure. Eric Fromm is the idea that you got to join with others to be fulfilled. So this is the idea that being in your room, playing video games, even if you're as happy as can be, that's not living potential. You got to mingle with the rest of the group, join the crowd. And Harry Stack Sullivan is the approach about understanding human behavior, the idea that it can best be understood when we watch people interact with others. So again, watching somebody play video games by themselves and behaving well, we can't determine that by themselves. We got to see how they do with the crowd. Do they try and kill each other? Are they socially awkward? Are they nervous? Well, we don't know until we throw them in with everyone else. Neo-Freudians. Okay. Solution focused. Now, we jumped earlier or I guess we jumped over, but we were talking about DBT, which is maladaptive thinking. This is a short-term, solution-focused brief therapy. So 6 to 8 sessions, 3 questions. It's, why, again, we're talking about why are you in my office? What are you trying to accomplish? The miracle question is probably the most famous one. If I had a magic wand, if a miracle would occur, how would you feel? The exception question, what if you didn't have depression? Or the scaling. So how bad are you right now? Scale 1 to 10. 8? Okay, what if we got it down to a 5? So again, this is just like the opposite of DBT, where there's a time and a place for this. So we're not going to fix a serial killer in 6 sessions. We're not going to cure borderline, next week. So, that's kind of, solution focus. So brief therapy, 3 questions. All right. Now, reality. Again, I always tell people if you forget the name or if you forget what it is, look at the name. I mentioned how, individual, it's the uniqueness of the individual. Reality, I think of get real. You know, it's based on choice theory and taking responsibility. And it basically is it's something in which it focuses not so much on what it is, but what it's not. I don't care about your unconscious ways. I don't care about your symptoms. I don't care about your mental illness or what happened in your past. The fact that you're in my office, you have the ability to, make this work, stop blaming others, stop making excuses, get out in this world and do something with your life. I think like slap in the face type therapy. Somebody who might be diagnosed with laziness. Basically, this is a very cutting edge.
Can I bill for that?
I'm sorry?
Can I bill for that? I think that's a lot of problems with a lot of my clients are just lazy.
Yeah, right.
Is that
Or,
a DSM code that I could?
yeah, exactly. Yeah.
That was a joke. That was just
Yeah,
a joke.
right. Yeah, absolutely. Yep. Or if they are a bad slap in the face type therapy, if they're a bad choice away from relapse, we may not have time to explore what got them there because their funeral could be before our next session. So again, this is a very cutting edge type therapy. And then the WDEP, what it wants, actions, evaluation, and plan, taking action, getting results.
I have heard recently, and we try to interview most of our clients after they pass, and I've still heard recently lots of reality questions on there, more. And remember, in general, when you're taking test questions, and if you see that you're saying the same question over and over and over again, the assumption is probably only one or two of those counts. Like broaching that new term that you're seeing, and you might see it 5 or 6 times, but we don't believe that all of those questions actually count. But I do think there's, just based on talking to our clients, I think we're getting more recently. I've heard a higher number of reality therapy questions.
Absolutely. William Glasser, reality.
I'm looking for the word responsibility. He says, you own it, you did it. You suck it up. You did it, you did it, you did it.
Right.
I talk about those 5 basic needs, right? We need love and belonging, fun, freedom. So if I decide to get love and belonging, from somebody else's husband, and I, she beats me up, I can't ooh, my father abused me when I was a kid. Nah, Glasser's like, get over it, girl. You made that choice. Take responsibility for the choices you made, because you did it. You did it. You did it. So I like that. I like that a lot. That takes away a lot of the blaming your mother for everything like Freud did. I just suck it up, girl. You did it. So it's one of my favorites.
Very good. All right. Narrative.
He's a girl.
This is I like narrative therapy. This is about, again, when I think of narrative, again, I always go back to that. If you forget, look at the name, narrative. What I think of narrative, I think of library, books, and stories. And if you're a counselor, someone's going to bring a story into your office, and it's not going to be a happy story. They're going to bring in a sob story. And so you're going to help them reauthor their story, not change it, not flip it, but look at it from a different perspective by asking questions, externalizing it. A situation where if someone's depressed, if their anxiety, their wife left the divorce papers, took off, and they've never been this depressed and lonely, I would say, client, let me ask you this. How happy were you in this marriage to begin with? Not very happy. How much nagging? How much money did she take from you? How many times did she complain? All the time? Do you think maybe she did you a favor by leaving? Maybe you should write a letter to her, thanking her and telling her not to come back. I mean, maybe I wouldn't do that, but again, homework assignments, from a narrative writing perspective. Again, narrative, helping the client reauthor, pros and cons, positives and negatives.
I often teach that with you have to be old to understand the way that I teach. Okay, so y'all remember cassettes? You remember those little y'all? Yeah, if you don't remember, you don't need to be in my group. That's for sure. Okay, so like little cassette tape, right? So back in the day, there's like 3 radio stations, okay, maybe 4. And if you wanted to like make a mixtape for somebody, you like had to call the radio station and hit like play and record at the same time, and they would play this, they'd play it and record it. So narrative therapy says whatever, it's also called constructive. You made up this stuff in your head. It's a constructive theory. So constructionism is I made it up. So, I've got this story in my head, this cassette player that keeps playing over and over and over and over again. Pam, you're not good enough. You're not smart enough. Blah, 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 blah. And that tape keeps playing. So sometimes you'll see the term problem saturated story. It's in my head over and over again. So what they want us to do is the same thing. We're going to clarify, right? We're going to understand where it came from. We're going to hit the eject button. Remember on that? Okay. If you have a car which still has a cassette player on it, you need a new car, just so you know. Okay. You hit the eject button, right? You take the cassette out. Okay. And I look at me like, what are you talking about? So just Google it. Okay. Because it's way before you were even born. So take the cassette had these like little strings. That's how it recorded. So he wanted you to deconstruct it, take it apart, right? And then you're going to reauthor it. You're going to rewrite your tape. So you're going to, put in that mixtape, that love tape. You're going to put that in your head. Another term that you'll see on the test that lets you know that's a clue for this one is collaborative. So this theorist writes notes many times with you in the session because they want to replay your own words. Okay, so it's not a test question. It's Michael White, but that's not a test question. That's just stupid knowledge that I have for, I don't know, Jeopardy. But that's not a test question. But that's how I kind of remember it, that cassette tape, and you're rewriting that problem-saturated story. And remember, narrative therapy is used with family, groups, couples. So when you learn the verbiage, it's used with everybody. That's how it works. We're rewriting our problem-saturated story. And I think as he's going over, and you're doing a great job, Jeremy, understanding the theories, it's a matter of learning the verbiage. So problem-saturated story, reauthoring, deconstructing, externalizing. Those are the words I'm looking for in a question, right? I've seen a question that talks about, let me see if I haven't been able to find any question I've been looking for today. But I saw a question once, and the question was, the little boy kept getting in trouble in school. It was a family narrative, and they called the boy the problem Mr. Trouble, because Mr. Trouble was not the kid, it was the story that was causing the problem. So we take that out of our head, we rename it. So again, externalization, reauthoring, and it's construct. So constructivism, you will see everywhere on this test. We can go back, we can talk about it in stats assessments, right? Because constructives, we can also see it in careers. We'll see it with Sabikes, because he used narrative therapy. So constructs are things that we've made up. Can you measure a happy marriage? Can you touch a happy, right? Those are constructs. So it took me a long time to just understand that term. So that's all that means. There's some stuff we made up. Do you like narrative therapy, Jeremy? Is that one of your go-tos?
I just like that story, that example of somebody who had a lover walk out on them, and I just like telling that story. And not that that's a personal experience story, but I just feel like
I don't know. There might be some countertransference there.
People seem to remember that. And
I like that.
Yeah, I didn't see that on my exam, but I've heard it since. So that's how I
like that.
Yeah.
I like that a lot. Very cool.
And that is actually wrapping up all the heavy hitters on helping relations. Dr. Pat, before we went over, you got in, I don't know if you heard or watched the earlier part that psychoanalytic, we did person-centered, CBT, REBT, Gestalt, and existential. I don't know, did you want to add anything to?
Did you do feminist?
We did not do feminist. I have not heard much about feminist from anyone. I mean, do you consider that a big theory on this exam, or?
I've seen a couple of them. And I think the one thing that I try to understand is that feminist is really not about just for women anymore. It's for people that don't have power. So as a minority, a woman of color, and if I went to my therapist and I said, you know, I'm depressed, she would say that it's not inside of me, it's society that oppresses me. It's not me, it's society. So sometimes when we see feminists, we'll talk about it's not just how to help me, but it's how to make societies change in society. So it's not just for women, it's for minority populations. So LGBTQIA. So anyone who's not considered the majority, which I'm sorry, Jeremy, that includes you today, a white male. So that's all our therapists, that's who we study, right? So it gives women and girls voices to be heard. And a key term is the personal is political. That what I'm feeling is not about me, it's about society. So the goal of feminist therapy is always to help change society as well. I like that one. I touch on Lazarus sometimes. He's the one that doesn't have a theory at all. He just borrowed everybody else's stuff and claimed it. Ain't none of that. But basic ID, he didn't own any of it. He took everybody else's and he owned it. So you might see something. He's eclectic. And remember, eclectic is not the same as integrative. So if people say you're eclectic, you tell them they're wrong, because eclectic is a jack of all trades, master of none. When you're integrative, you're you. You use the way that you use Freud, you use the way that you use the empty chair, you do all those things the way that you do it, because that's what makes you integrative. And I know that your people around you will say, well, you're eclectic. For the test, that's not the right answer. And we only teach to the test. So that's kind of, but I always like it when you walk in smart and go, no, I'm not. That was Lazarus. I'm integrated. I know my stuff.
All right. And again, like I said, if anyone has any questions, you either can speak up or put it in the chat box, but no one's talking. So I'm just going to jump to groups, which is another important part of this exam. And of course, with groups, I always start with the stages. And I always tell people, if they're at least starting off, if you were a group member and you were going into a group, what would you be doing? You'd be driving there, parking your car, going in there, paying the fee, signing the informed consent, room 212 to the right. You're forming. We're forming, and then get to work. Well,
guys, I'm going to step out.
please. So, yeah.
Anything you want to ask me? Anything in general, overall, you want to ask? Jeremy knows everything that I know.
Not so far. Thank you, though.
It's been a pleasure. I hope that I see you in a group session with me. I hope I see you in a session with Jeremy. I hope that you really take advantage of we truly believe that we've got the best and brightest. You are the smartest people ever. You're great counselors. You just don't know how to pass a standardized test. That's the skill that we teach, is your sucky test takers. Just own it, own it, own it. Okay. You sucked on the GRE. Just come on. You wouldn't got to grad school if you didn't have a high GPA. Own it, own it, own it. So we teach you content and how to pass a standardized test. So that's what makes us so very unique. So enjoy this session. You'll get it. You'll watch it over and over again. But if you're testing soon and you find that, he's bringing up things that you just don't know, or you're lost, join us for a paid session. It's really worth it. So you don't keep retaking this test over and over and over again. Bye, guys. Thanks for letting me hang in for a little bit today. Jeremy's amazing. Suck the life out of his brain. Ask him questions. Yep. Bye.
Fire away. Hit me with something. Absolutely. All right. Okay. So, and again, as I said, we got some people that are still joining us. Okay. So we got about 6 to 8 minutes left. So again, I'm just going to keep going. And if anyone has a question, jump in, ask away. But again, groups is important, and forming, storming. Again, storming, there's a reason they're in a group to begin with, and they're probably not going to be holding hands. They're probably going to try and kill each other first. And typically, when it storms outside, people don't associate that with peace. It's, you know, not good. But then we shift, and then it's almost like it's called the norming stage. And I think of this as when you got two enemies at the bottom of a hill, and as much as they hate each other, they realize the only way they get up to the top is if they work together. So they decide, all right, let's just play nice, and once we get up there, then we'll kill each other. And what happens? They become friends on the way up to the top, norming. And now that we're friends, we see results performing. That is how that goes. And then, of course, after that, so long, bring on the next group. We're done here. And again, groups, and of course, this is Tuckman. Now, there's another guy, his name is Corey, and he has a few different names. Now, they don't mean anything different than Tuckman. They're just called different names, like tomato, soda pop, all depending on where you live in the country. But he calls what Tuckman calls the storming stage, Corey calls it the transition stage. And typically in life, when you go through a transition period, it's kind of stressful. He also calls what Tuckman calls the norming stage, Corey calls it the working stage. And when we're working, usually that's pretty good. So that is how that is. All right. So again, that is, and again, with curative, then of course we got the curative factors, altruism, the concern that one group member has for another, universality, that belief that, wow, we all share some of the same things in common. Cohesiveness, that's a big one. That's everyone buying into the group process. And of course, catharsis, you're releasing the emotions, which, and again, this is kind of going back to the stages. They could ask you, in what stage would something happen? And if you're releasing emotions, it's probably not going to be in the early stages of group, because in the early stages, it's like, I don't want to talk to you. Resistance. So what's the opposite of that? If it's all coming out. So again, that is, and then of course, it always comes back to helping relations. As you see, installation of hope, that's, remember, existential. And then of course, groups is part of the family dynamic. And then again, more helping relations. These are group, so not in addition to group member terms, there's group leader terms. Active listening, reflecting, clarifying, summarizing. Rogers, person-centered. Yep. But it's in a group. And then of course, some of them are in the name itself, like blocking, where no, that's inappropriate. We don't do that here. Or modeling, suggesting, linking. Isn't it interesting how what this person was going through with grief is the same as what this person's going through? Literally, Lincoln, you and you. So there you go. Those are, again, and then of course, groups. So groups is a big thing. And the preventative, primary, secondary, and tertiary. Primary, preventing the group, or we're preventing something. Actually, no, what am I thinking actually here? Hang on. Yeah, preventatives, secondary, small, tight, long-lasting, direct, intimate relationships. Secondary, groups gathering to achieve a shared goal or common interest. Actually, I was thinking of something else here. Prevent. Okay, yeah, primary, secondary. Primary is also preventing. So in other words, bring in a speaker to talk to a second grade group of kids about DUI. Don't do it. Buckle your seatbelt, again, because they haven't started driving yet. The key is before it happens, preventing it. Secondary, we're trying to push them back on the straight and narrow because they kind of got off track. So I think of this as a 16-year-old who got busted for smoking marijuana at a school dance, assuming they're not an addict, assuming this was their first time trying it. So we're just trying to, push them back on the straight and narrow before, so they don't get, off track, really off track, because tertiary is off track. It's relapse. It's full blown addiction. Gambled away all the money, and it's basically now it's recovery. The damage has been done, so we're basically picking up broken pieces. So there you go. All right. Any questions? I don't know. We got a few minutes left. So any questions? And for those of you who jumped in here kind of, afterwards, just want to put in here I got some discount codes that I put in the chat box for anyone who either wants a one-on-one or wants to partake in those boot camps, which is actually run by Dr. Pam, the owner who was here earlier. For those of you who were here before, she does a great job, of course. She taught me everything. She's pretty much the reason that I passed. If I hadn't found her, I don't know how it would have gone, but there you go. So again, again, there's so many things we could have gone through. I went through, at least based on what people are saying, people are hearing, what we're seeing, based on what people are posting on social media from their printed out scores, what the heavy hitters are. Helping relations is still a heavy hitter. That's not changed. Groups, still a heavy hitter. When people post their scores, I pay attention to not what the passing score is, but how many in each domain. And that's pretty consistent. So,
Hi. Hi.
yeah, go ahead.
Was there any,
Yeah, go ahead.
Patrice?
Yeah, go ahead. Yeah, go ahead.
What about clinical interventions? Anything on intervention?
As far as, I
I
mean,
guess
I don't,
I'm studying for my LCSW, so I don't know if I'm in the right group or not, but everything has been great thus far.
oh, thank you.
But I was just thinking about clinical interventions.
I don't believe so. This is for the NCE and CPCE. So I don't know if that's, but again, I know some of these
Okay,
exams are actually, it's similar. Like, I mean, there's similar material. There is kind of a crossover. So
got you.
but I haven't heard much about interventions on this exam. So I can't speak for that one though.
Okay, thank you so much.
No
I've
problem.
enjoyed myself tonight.
Oh,
Thank
thank
you.
you. Glad you. So I'm just going to, any questions?
Coach,
Yeah,
Coach,
go
I have
ahead,
one question.
please.
I know a lot of people are using counseling exam to practice, especially with the narratives. But it seems like I've been testing those same ones over and over
Yeah.
again. So, after a while you start memorizing them, the
Yeah.
answers.
Yep.
So that was my problem with my exam this past week. It's just like I was passing the narratives, I was passing the practice tests, and I was like, okay, I'm ready. But then I get to the test and I did puzzle at some certain parts. So I wanted to know, which site do you guys recommend for us to practice with?
You've Pocket Prep downloaded on your smartphone. It's free, or at least there's a free version, Pocket Prep.
Okay,
Yeah.
okay.
And uh, feel free if anyone else wants to either speak out or chime in on the text. But Pocket Prep is what I've been told is the most relatable to the type of way that they ask it on the exam. There's a paid version and there's a free version. And again, you can go through all the versions, and then like what happened with that, you're going to remember, and then just based on the fact that this is going to be C before you even read the question, to make it.
Right.
But that's something. So again, Pocket Prep. Uh,
They have the
How-
NCE exam for free.
it is free.
You can do a NCE for free if I think you
Oh,
can just
I
Google it.
think, yeah, I think that you could get one exam, but I think again, just like the Pocket Prep, I think there's a paid version where you can, because again,
Yeah,
you can only take that exam for free
one
so many
time or something,
times.
yeah.
Well, even if you could take it, you're going to remember the answers, if you keep taking
Right.
it like 100 times. So, but I think there's a paid for all these things. There's paid versions for. Of course, they want to get you to fall in love with it. Yeah, please feel free to chime in.
There's
Jump in.
also something that it's called like the NCE secrets questions, and it has like 800 questions.
Oh,
So
I'm so
there's a
sorry. Which one was that one?
it's called NCE secret questions or secret like
Okay.
Jeremy sent it to me. So
Yeah,
it's like
let's see. Yeah, actually, well, yeah, everything. I'm gonna send that over to everyone here. Um,
and it has up 800 questions, like all NCE.
yeah, you're gonna get because everyone's on that little Pearl thing. So yeah, I'm gonna upload that. And Hellwig book, there's questions at the end of that too, which you're gonna get as well.
Mhm.
So yeah, I mean that I think that's about
Okay. I
yeah, so
appreciate
yeah,
it. Thank
no
you
problem.
guys.
Yeah.
Thank you.
But yeah, you will and NCE secrets. Um the Rosenthal, there might be questions on the back of that. These are all kind of scattered what I'm thinking now. And yeah, so that should give you enough to kind of chew on that, for thousands of questions where you should be good for a while before you start remembering them. Yeah.
Rosenthal. Okay.
Yeah.
hmm
Any other questions?
I heard you say about the PowerPoint. Are we gonna
Oh,
receive
yeah.
that?
Well, somebody asked about this is
Um,
this is not it's Arc browser. It's basically kind of like a Chrome based thing that you can just all like put pictures on stuff and links. But yeah, all these are pictures and these are um I copied these over from Hellwig. So like this is all Hellwig stuff right here.
oh,
And the pictures obviously I matched Hellwig with some Google stuff. It'll
mm-hmm.
go into your, aside from the questions, everything that you see here is going to be uploaded to your little chat box once we get off here. And this recording will also be public for you as well. So
Okay.
there you go.
Thank you.
No problem. All right. So, all right. So I'm gonna stop the recording right now and do this. Stop the cloud